So your doctor or hospital says they will not circumcise your baby boy unless you give him the vitamin K shot. Hi, I'm Dr. Brittany Todd. Let's talk about why that might be the hospital or doctor policy. First and foremost, any provider or hospital has the right to make their own policies. But if your decisions don't match their decisions, that's okay. Just find another provider. But what is the actual risk of not giving a baby boy vitamin K before a circumcision? I have several videos talking about the risks and benefits of vitamin K. I am going to focus solely on circumcision risk in this video. As we all know, babies are born with very low levels of vitamin K, so if you do any procedure that can cause bleeding, there is an increased risk of bleeding in newborns. But is vitamin K really necessary for a circumcision? The overall risk of bleeding in circumcision is about 3%. But only 0.1 to 0.2% actually need some form of intervention. That means a little extra pressure, maybe a little bit longer, extra sutures, possible cauterization, and just topical treatment. It is incredibly rare for a baby to have such significant bleeding from a circumcision that they require maybe hospitalization or blood transfusions. There was one case report of a baby that required further intervention after circumcision who did not have vitamin K before the circumcision, but when he started having bleeding complications, they gave him vitamin K and within 30 minutes the bleeding stopped. And that sometimes is the difference between prevention and treating when necessary. There have only been a handful of case reports of death post-circumcision, and these are in babies who were later diagnosed with hemophilia or factor V Leiden. And basically, it was not the circumcision that caused the death. The circumcision just allowed the physician to realize they had a bleeding disorder, and unfortunately, some babies died, not from the circumcision, but from the bleeding disorder. There have been surprisingly very few studies looking at this. In 1960, Vietti et al. Did a study, and half of the boys got vitamin K prophylaxis and half of the baby boys did not, and he found a significant reduction in bleeding risk in the babies who got vitamin K. However, the severity of the bleeds were not reported. There was one mention of a baby who required extra suturing, which tells me that they probably did not have any extra hospitalization, transfusion. They were all minor bleeds that just required a little bit more pressure. They had a little bit more bleeding risk. What's also interesting to note about that study is not all the babies got IM vitamin K. Some of them were considered prophylaxed when their mom was given oral vitamin K before the baby was born. So baby never got their own vitamin K. Another paper looked at over 19,000 baby boys. Half of them got vitamin K, half of them didn't, and they found a 5 to 10 times risk of bleeds in the babies who did not get vitamin K. Again, they did not report the severity of the bleed. Most of the babies required just a little extra pressure for a little bit longer to stop the bleed. Another thing to note is providers have known for a very long time, even before vitamin K was available, that babies had a higher risk of bleeding within the first few days of life. And most providers, before vitamin K was available, said they would not circumcise until about day 8 of life, which is interesting because that's biblical. That's when the Jewish faith does their bris, on the 8th day of life, because bleeding is lower after about 8 days. So because there is a higher risk of bleeding in babies who did not get vitamin K, most providers simply say, no vitamin K, no circumcision. But many providers will say, no vitamin K, let's just wait 8 days. So does this mean you need to give your baby a vitamin K shot on the day of birth in order for them to get circumcised? Well, if you want to, and the provider says that's what they require, go ahead. But if you don't feel comfortable or you weren't planning on giving vitamin K, you still have options. So now you know. You can decide, do you want to give it and circumcise in the hospital, or do you want to wait and circumcise later? That's always up to you.